So today we've got a menopause education day aimed at healthcare professionals from primary care. We're going to have talks about diet, we're going to have talks about alternatives to HRT, we're going to have a session about osteoporosis. So lots that's going on that we see day to day in our clinical practice with menopause, but it's really important to get the right advice from the main experts.
Speakers have been excellent. I found it really interesting. I am familiar with most HRT, but I lack quite a lot of the added extras, if you like. So understanding the importance of proper sleep, of nutrition, of extra things, I now feel more confident in advising my patients on best practice.
For me, it's been about understanding these other specialities, about understanding what they do in the clinics when I refer patients onto them, how they will approach the problems that I'm referring the patients over for. So you know that you're sending people to the right specialities, you understand how they work. It's been very good.
It's proven to be exactly what I'd hoped it would be. By speaking to everybody here, it's really nice that there is that kind of supportive network and you're kind of in it together. Really helpful, really positive. I would definitely do it again. Really, really beneficial.